So welcome to this session on sciatic nerve. In the introduction of the sciatic nerve, we say that it is the thickest nerve in the body. Okay. Also, it is because it is so thick that inside this nerve there is a separate blood vessel coming from the inferior gluteal artery. Okay. So it's the blood vessel is there inside the nerve, and therefore this nerve is also called as pregnant nerve. Okay. It's a branch of the sacral plexus. And it is actually a combination of two nerves, the tibial nerve and common peroneal nerve. These two nerves are wrapped in a common sheet and they together form the sciatic nerve. Now the sciatic nerve, let's talk about its root value. Now, whenever the root value is asked, students very easily say that L4, L5, S1, S2, S3. No, it is not like this. For tibial nerve, it is the ventral divisions of the anterior primary rami of L4, L5, S1, S2, S ventral division, because tibial part supplies the flexors, and the common peroneal part. The common peroneal part, the root value is dorsal divisions of anterior primary rami of L4, L5, S1, and S2. Okay. So that's about the introduction of this nerve. Now, in gross, if I want to talk about its course very fast, this is how I will talk about the course, that it actually starts in the pelvis from the sacral plexus. Then it leaves the pelvis by passing through the greater sciatic notch. Okay. We'll discuss this in detail. It passes through the greater sciatic notch and then it enters the gluteal region. It leaves the gluteal region by passing between ischial tuberosity and greater trochanter, and then it goes to the hamstring compartment. Then it goes to the hamstring compartment and it ends by dividing at the superior angle of popliteal fossa. And we'll be discussing all this, how it starts in pelvis, how it leaves the pelvis by passing through the greater sciatic notch, how it enters the gluteal region, what are the relations, how it leaves the gluteal region by passing between ischial tuberosity and greater trochanter, how it goes to the hamstring compartment, and how it ends by dividing into at the superior angle of popliteal fossa. So let us discuss the relations of the sciatic nerve and course. So the course, we said that it starts in the nerve in the pelvis. So in the pelvis, so what are the relations? It lies. What are the relation? It lies anterior to piriformis. Okay, it lies anterior to piriformis. So we know that the piriformis muscle has this E-shaped origin like this, and it goes like this, and the sciatic nerve is passing anterior to it in the pelvis. We are looking at the pelvis from the anterior aspect, and the piriformis is going like this, okay, and the nerve is going like this. So it lies anterior to piriformis. Then it leaves the pelvis, by passing through the greater sciatic notch. So passing through the greater sciatic notch. Okay. So if this is the greater sciatic notch, and coming out of the greater sciatic notch is piriformis. Okay, so piriformis is like, and because it is anterior to piriformis, and now we are looking from the posterior aspect, we'll see this nerve coming out of the greater sciatic nerve under the cover of fiery cortex. Okay, it passes through the greater sciatic nerve and enters the gluteal region. What are the relations in the gluteal region? In the gluteal region, it lies on the superior gemellus. This is obturator internus. This is inferior gemellus. So it is, we are looking on the posterior side. So when we are talking from the posterior aspect, we say that its anterior or deep relations will be superior gemellus, obturator internus, inferior gemellus, quadratus femoris. Okay, these are the things on which it is lying. Quadratus femoris. Also, it will lie on the hip joint. Okay. What are its superficial relations? Of course, the gluteus maximus will be superficial or the posterior relation. So covering all these structures is gluteus maximus. Okay, so which is its superficial relation? So superficial or posterior relation is gluteus maximus muscle. Gluteus maximus. Okay. Also, sometimes there is posterior cutaneous nerve of thigh. Okay. What is its medial relation? Inferior gluteal nerve. Okay, and posterior cutaneous nerve thigh sometimes. The posterior cutaneous nerve can be posterior or it can be medial. Now what happens is this is the ischial tuberosity from which the quadratus femoris takes origin and it is getting attached to the greater trochanter. So this is the greater trochanter to which all these muscles are attached. This is greater trochanter, this is ischial tuberosity. So the nerve leaves the gluteal region, leaves by passing between ischial tuberosity and greater trochanter. By passing between ischial tuberosity and greater trochanter. So now what happens is as it reaches after passing between the ischial tuberosity and greater trochanter, it goes to the back of the thigh. And in the back of the thigh, this muscle which on which it will be lying is adductor magnus. Okay, it's a huge muscle, adductor magnus. But taking origin from the ischial tuberosity are the hamstrings. And the one of the hamstrings which will be crossing it like this and going to the lateral side. So this is the medial side, this is lateral, is the biceps femoris. And also along with that is the semitendinosus. And behind the semitendinosus is semimembranosus. Okay, so the sciatic nerve is here, like this. So the relations now we are talking about the back of the thigh. So the back of the thigh relations is superficial relation or posterior relation is biceps femoris, which will be crossing it. Long head of biceps femoris. Long head. What are the deep relations? Adductor magnus. It is lying on the adductor magnus. What is the medial relation? Semimembranosus, semitendon. What is the lateral relation? By long head of biceps femoris. Long head of biceps femoris. So that these are the relations in the heart. Okay. It is always accompanied by a artery. This artery. This is also one of the relations. This is a branch of inferior gluteal artery. Okay. Now this nerve, its division we cannot predict at what level it divides. So it ultimately divides into tibial nerve and common peroneal nerve. Tibial nerve and common peroneal nerve. Now let's talk about the branches. So branches, we have this formula MAC V. So firstly, let's talk about the muscular branch. So tibial part of the sciatic, tibial part of the sciatic supplies semimembranosus, semitendinosus. It also supplies the long head of biceps femoris, and adductor magnus. Okay, adductor magnus, especially its ischial head. Okay. Then when we talk about the common peroneal part, it only supplies the short head. It supplies the short head of biceps femoris because it is not a hamstring. Okay, articular branches go to the hip joint main. Okay. Talking about the clinical anatomy, you have to mention this shooting pain whenever there is any problem at L4, L5, S1, S2 level. The patient experiences shooting because this is the longest now and its branches will supply right up to foot. So pain, the patient gets shooting pain, and this pain is starting from the gluteal region and along the back of thigh and goes to the foot, and this is called as sciatica. Okay. Compression of the sciatic nerve can cause slipping foot. What is slipping foot? The compression of the nerve, so person gets slipping foot. And in case of a damage due to wounds, a person can get foot drop. Because the common peroneal part will supply the extensors of the foot, so they will also drop. And during amputations, so one is sciatica, another is the slipping foot. That is, slipping foot is temporary. Sitting for a long time can cause the slipping foot. Foot drop is due to wounds, and during amputation we have to ligate the companion artery. Which is a branch of inferior gluteal artery. We have to ligate the companion artery, otherwise it can lead to bleeding. So that's all about the sciatic nerve. I'll quickly revise. This is the branch of it is the thickest nerve in the body. It's also called pregnant nerve, branch of the sacral plexus. It is a combination of tibial nerve and common peroneal nerve, which are together in a sheath. The root value of tibial is different, common peroneal is different. Tibial is ventral divisions of L4 to S3, while common peroneal is dorsal division, because common peroneal will divide into uh, deep peroneal and superficial peroneal, and deep peroneal will supply the extensors which are supplied by the dorsal division, while the tibial will keep on supplying the hamstrings which are flexors of the knee and the flexors at the calf which cause flexion of the ankle. The force is, it starts in the pelvis, leaves the pelvis by passing through greater sciatic nerve, enters the gluteal region, goes between ischial tuberosity and greater trochanter, and goes to the hamstring compartment and ends by dividing at the superior angle of popliteal fossa. So in the pelvis, it lies anterior to piriformis. Now this is looking from anterior side. Now we look from the posterior side. The pelvis are passing through retrosciatic notch, and now here it is below the piriformis. Okay, piriformis, it is anterior, but because we are looking from behind, piriformis is posterior. Right. Now piriformis is superficial and posterior. So in the gluteal region, it lies on all these muscles, right? It lies on the superior gemellus, obturator internus, inferior gemellus, quadratus femoris, and hip joint. Superficial relation is gluteus maximus. Okay, medial relation is inferior gluteal nerve and vessels, and the posterior cutaneous nerve of thigh. Okay. Then it passes between ischial tuberosity, greater trochanter, and enters the back hamstring compartment. Its superficial relation is long head of biceps femoris. Deep is adductor magnus, medial is semimembranosus and semitendinous. Okay. Branches, the tibial part supplies semimembranosus, semitendinosus, biceps femoris, adductor magnus. Common peroneal part supplies the short head of biceps femoris. Articular branches are to the hip joint. 4 applied anatomy. 1, the pain in the gluteal region goes pain in case of damage to the roots of the nerve runs from gluteal region to back of the thigh to foot, which is called as sciatica. Sleeping foot is just a temporary compression on prolonged sitting. We have difficulty in moving the foot. But in case of wounds and the sciatic nerve is damaged, it leads to foot drop. During amputation, we cannot forget to ligate the artery. The artery is there inside, so this artery has to be ligated. That care has to be taken during amputation. So that's all about sciatic nerve. Thank you so much.